My name is Hans Keirstead. By way of background, I'm a classically trained neuroscientist, a PhD, then postdoctoral fellow at the University of Cambridge in England. And then I became a professor, assistant, associate, full professor for 15 years at the University of California at Irvine, and simultaneously had an appointment in Keio University in Japan. During that time, I published over 150 peer-reviewed publications, have about 120 patents, received about $3 million a year in grant funding for each of those 15 years, running a large lab, about 48 people, and charter member of the National Institutes of Health, built a building funded by donors as well as the California Institute of Regenerative Medicine that ended up being one of the founding and premier stem cell centers in the United States. Besides academia, I also run a corporate life. I've built and sold 3 biotechnology companies, all returning investment to investors, and on top of that, a 2.5x, a 4.5x, and a 9.5x return in 2 to 3.5 years for each one of those runs. I'm also a government advisor. I've advised some 14 nations on emerging medicines, spoken at the UN and AI for Good meetings at the United Nations several times, talking about leading cutting-edge medicines and how governments and countries should be preparing for them. Are they real? Are they not? Do they need to be regulated? What should they be compared against? Should the economy be changed to promote particular emerging medicines? So really focusing now on AIVITA's development. I'm the CEO and chairman of AIVITA Biomedical, and we really had a core asset that I'm just absolutely thrilled to have licensed to LevEllis. And let me quickly run through the data that we generated by way of generating this asset and preparing it for commercial launch. After generating the product, we began working with perhaps the most critical clinical dermatologist in the nation, Zoe Draelos, who's widely known for testing pharmaceuticals and letting the world know if they're good or not. So Zoe Draelos ran independently a double-blinded, 4-arm, 12-week clinical study of over 100 patients. And her own assessments showed tremendous recovery beginning at 2 weeks and continuing in an upward trend after that. She showed that the appearance and general integrity of the skin increased in a dose-dependent manner over time. She showed that the wrinkles, the skin firmness, the radiance in the skin texture increased in a dose-dependent manner over time. And perhaps the most impactful for me was her finding of transepidermal water loss being tremendously decreased. This is the loss of water from one's skin, and it's usually stopped when you're very young, when your stratum corneum is nice and compact, that outer protective layer of your skin, and that layer gets sort of like a flaky pie crust over time as you age and you lose water. This product has no barrier function, no Vaseline sealant type of function to it, yet it decreased the loss of water from the skin. That suggests histological evidence of repair of the stratum corneum. In fact, when we did histology, we did find out that the rete-peg was statistically significantly increased, showing really an age reduction of the skin. We also showed that filigrin was almost doubled, again, a marker of the age and elasticity of the skin. We showed that aquaporin, those water channels that allow the flow of materials in and out of the skin and water, they're also significantly increased. Really, really impressively, collagen deep in the dermal layers of the skin was significantly increased in all treated patients. And even on 3-dimensional models of the skin, we saw these benefits, the collagen ratios, filigrin, etc., bettering in these 3-dimensional histological assays that are truly unequivocal in their data generation. We also used, separately from Zoe, a testimonial group of 30 women over the age of 35, looking at the entire milieu of actions or potential actions of this product on their skin after their own usage. And we just saw in a good 30 different outcome measures a movement from, with 60% of people showing something to high 90s% of individuals showing things like the radiance of their skin, how they felt better, age spots and red spots going down, wrinkles being reduced, etc. So this also showed just tremendous benefit. So, from internal analyses to third-party double-blind analyses, we did our part in generating a product that shows unequivocal, double-blinded, randomized data showing efficacy. And I'm just delighted to have partnered with LevEllis in order to now take this beautifully developed soup within a bottle and put it in the right bottle, put it in the hands of a group that is an expert set of commercialization individuals with the skill set and the resources to take this to the market and get it out into the world. And I'd like to introduce you to the Chief Executive Officer of LevEllis, Dr. Laura Ellis.
Thank you, Hans. I'm Dr. Laura Ellis, co-founder and CEO of LevEllis. I received my MD degree from UNC at Chapel Hill and have been a cosmetic surgeon and health and wellness doctor for 21 years. During the clinical and commercial testing phases of our product, PROVOQUE, my patients used the facial serum every day. They loved it because it made their skin appear healthier and younger. Our vision for PROVOQUE is to provide all people, men and women, young and older, with a foundational product that allows them to look and feel healthy and beautiful. My routine is a gentle cleanser, PROVOQUE, a topical antioxidant, I use Retin A, and sun protection. Simple and effective. We invite you to join us in offering simplified, proven, and effective skincare to everyone.